Hello and welcome to Sheffield Live. My name is Violet Jallo and this is African Voices Platform. Joining us now is the Director of Public Health Sheffield, Greg Fell. Hi, Greg.
Hi, Violet.
We are back again on the same situation, so COVID again. So I just want you to give us an update in terms of the Omicron variant. What's the latest? What do you know so far?
So over the Christmas New Year period just gone, so a significant increase in the number of people seeking a test. So the number of people with symptoms that try and get a PCR test. So over the last 14 days, somewhere in the region of sort of nearly 40,000 people. Over the last 7 days, nearly 20,000 people have sought a test. And that's a massive increase on the 14 days previous to that. Of those that get a test, in the last 14 days, somewhere in the order of 16,000 positive tests, so 16,000 cases across Sheffield, reasonably evenly distributed across Sheffield. So, and the seven-day case rate has just skyrocketed. So over late autumn was in the order of 250 to 300,000. Sorry, 250 to 300 per 100,000 over a 7-day period. Currently, yesterday it was just over 2,000 per 100,000, so not far off a tenfold increase over the last couple of weeks. What you've seen in London is happening here. Principally working age adults, but not only working age adults, it's also increasing pretty quickly now in adults aged over 65. That's the group that I worry about most, because that's the group that are most likely to be poorly. So test rates have gone up, case rates have massively gone up, and unsurprisingly, it's feeding into hospital data. So the number of people admitted to hospital has shot up over the last couple of weeks. What we are seeing is people in hospital who have milder disease than we've seen before, so less use of intensive care, which is clearly good news, no two ways about that, but still significant number of people hospitalized, and I would wish hospitalization on nobody, actually. So that is the worry for the future. I don't think that's going to change anytime in the next month or so. We're beginning to see London, which was ahead of us in the Omicron wave, beginning to turn the wave now. We're probably about 2 to 3 weeks behind London, so I don't think that's going to change anytime soon. What has held up is vaccination. So there was a massive push on booster jabs just in the run up to and over the Christmas and New Year period, and the huge acceleration in the numbers of boosters given. There were days where 10,000 vaccines were given, and that's just unheard of. And credit to all those that made it happen, both in the NHS and in the voluntary and community sector, who are encouraging people. It didn't happen by magic; it happened because people did a lot of hard work. So that has held out. The protection that vaccination gives us against severe disease has held out. It was one of the things I was worried about just before Christmas, but it appears that the science has saved us once again. So thank you to the science for that, because that's decreased the severity of the illness throughout. So that's just about the situation report, but I do think we're in for a very, very difficult few weeks.
Right. Thank you for that, Greg. Just a couple of questions that I have, on this new variant, the Omicron variant. I mean, how do the existing COVID-19 treatments hold up against this new variant? Because, we've seen news across where, they keep on saying it's not that severe, it's not that serious. But, if we look back how serious the first variant was, how comparable would you say the Omicron is against the new treatment?
So, the evidence is suggesting that the Omicron variant causes a milder disease in most people. Milder doesn't mean mild; it's a relative term. So there are still people who have very, very severe illness, and there are still people who are admitted to intensive care. But there's two ends to the problem. Well, yes, it is a milder disease in many, and the treatments that we have, most notably dexamethasone, which is a steroid treatment, works pretty well actually for people who have severe symptoms. Just as well for people who have severe symptoms from Omicron as it did Delta and then Alpha and whatever the variant was before Alpha. And ditto, the vaccination has held up. But just because it's milder doesn't necessarily mean it's mild. There are plenty of people who actually have pretty bad symptoms and feel pretty poorly, some of whom bad enough to be hospitalized. And the other side of the problem is it's hugely more transmissible than Delta. And remember, Delta was much more transmissible than what went before it. That means there are more people with the illness because it just spreads through a population much more quickly. And people who had been previously infected with Delta or Alpha are also now being reinfected with Omicron, which is a new and unfortunate twist. So there are more people, admittedly on average, who have a milder disease, but because there are more people, there are still going to be plenty who have very serious symptoms.
Thank you for that. Also, there is, a bit of anxiety, within the communities, who are really not educated well so far to understand how severe they. So there's been a bit of complacence, within the public where still they're not taking it as a Delta variant. So what message are you giving out to the community out there, for people to actually guard it as much as they did against the Delta variant?
I suppose nothing much has changed. The reality is it is a milder, causing a milder illness, but there are just more people with it. So some people, maybe many, will get lucky and have fairly mild symptoms. Some won't. Some are going to be hospitalized. So all of the things that we could do to protect ourselves against Delta and whatever came before Delta are all the same things as now. Wearing face masks, getting vaccinated. If you have symptoms, if you're poorly and or if you've got a positive test, stay at home. All of those things are still in play. The reality is that many people will have mild symptoms, and that was the case with Delta, it was the case with Alpha, and it's also the case with Omicron. Some will not be so lucky. Some are going to be hospitalized, and as we know with Delta and all of the variants before it, plenty have died. It's caused in the order of 1,400 people to lose their life. So it's not a trivial disease by any stretch of the imagination.
Okay, so my last one on this one is, the severity of the Omicron. We know data, which is out there, does basically say, yes, there is more infections out there, for the Omicron variant, but not as severe as you rightly just mentioned. I mean, is there any really adequate data, that would suggest, perhaps, any adequate data might give a good impression, to the public that, yes, there might be more infections out there, but actually the severity might be less. So we just want to kind of like get to know exactly whether the data which is being held at the moment for the Delta variant can hold up, with the data that's been collected for the Omicron variant at the moment.
We don't definitively know. It's based on observations. It's based on observations from the clinical frontline, which they appear a long time before the hard data appears. Eventually, some bright spark will turn it into hard data and a pretty shiny graph that will land on my desk. But the observations are that the people who are unlucky enough to be admitted, and you have to be pretty poorly to be admitted to hospital, and again, I wouldn't wish that on anybody. There are plenty who have been admitted to hospital, but they tend to have less severe symptoms and probably a shorter length of stay in hospital than people who are admitted to hospital with Delta. That's developing all the time, and next week we might have clearer data, and that the picture may get better or it may get worse as time progresses, because one thing that is definitely the case with this is it's continually evolving.
Thank you
so much, Greg. Thank you.
Yeah. So basically right now, in terms of the current guidelines regarding COVID, so what are the guidelines right now? What will you advise? Is there any difference between local guidelines and the national guidelines?
Same as they always were. We've never really changed the guidelines. We've never really changed the strategy. So get vaccinated if you haven't yet done so, and there are still plenty that have chosen not to be vaccinated. There's always vaccine available for people that just they didn't get around to it. They think they missed their chance. Group, there's we're always available to talk to people. If people are worried about side effects, this, as with any other medical intervention, does have side effects. So if people are worried about those, talk to a clinician or get information from reputable websites, not Bob from Facebook. But most importantly, get vaccinated. But all of the other stuff, wearing face coverings, washing hands makes a difference because we still do that. Wearing face masks in enclosed public spaces. I wouldn't spend too much time wearing a face mask outside. There's probably not much point, but certainly inside, I tend to wear a face mask in shops, on public transport, etc. And if you have symptoms, stay at home. And even if you have symptoms, then get a test and the test is negative, that it could be flu, it could be any number of other horrible, nasty respiratory bugs that circulate this time of year. So if you're poorly, don't go and spread your bugs to others. So all of that's been fairly constant throughout.
And speaking of the vaccination, though, how will you describe the uptake right now in Sheffield?
So all up, 77% are fully vaccinated, and so are 2 doses and booster. It's very age driven. So in very old cohorts, so the 80 pluses, it's close to 97-98% are fully vaccinated plus booster. Much lower in sort of the 20 to 30-year-olds. That will catch up, but it won't quite get to the same level. And sadly, there's an east-west split, as is sadly often the case. And there's also a black, Asian, white split as well. Not as bad as I'd feared it might be at the very start of all of this, but there's still a split there. So there's still more to do in terms of helping people make choices that they feel comfortable with. I'm not one for forcing people to be vaccinated. People need to make an informed decision whether or not they want to be vaccinated. My only caveat on that is that where do you get the informed bit of the informed decision? I usually point people towards an nhs.uk website, or to be fair, the BBC have done a pretty good job on this. There's a lot of interesting stuff on Facebook, most of which is rubbish. When people are making informed decisions, I tend to just ask them how they've made their informed decision. But if they've made an informed decision not to be vaccinated, I respect that choice. That is their choice, and I hope people will be vaccinated. But if people have chosen not to, I kind of respect that. But there's still more to do to get our vaccination coverage higher than it is, particularly in Black and Asian groups, and particularly in the east of the city.
And talking of the concerns there, those are concerns, isn't it? Looking at people these days focusing on the information they get from social media,
yes,
rather than looking at places like the NHS, like you mentioned there, or trustable websites or organizations. So in terms of people who are still skeptical, like you said there, about these vaccines, like some people arguing, look, we were informed at the beginning that we will only need first and second dose, but now we're going third, and we might even need more. So what can you say to those people? And the argument there that this might even lead to like a 4th dose, is that the case?
So I don't know. I genuinely don't know whether or not we'll get into 4th doses, 5th doses, 54th doses. It's just impossible to tell. If I had to call it, I think when we first got into this, the science wasn't awfully clear whether or not 2 doses would be enough. We genuinely didn't know. This was a new disease to humans, and the vaccines were produced quickly. I'll reiterate, no corners were cut in the sort of the regulatory approval of those vaccines, but it was done quickly. It was done quickly, and it was done correctly, but quickly. So we just didn't know whether or not we would need boosters. The science develops. The policy response develops, so we're now doing boosters. Boosters have made a massive difference. What we saw was that after 2 doses, the immune response waned. Therefore, you were less protected against severe disease. Hence, our push on boosters in the run-up to Christmas that definitely has made a difference. There's no lives have been saved by that push. There's no 2 ways about that. If I had to crystal ball gaze as to what might happen next, I think we'll be in a position rather akin to flu, where we have the flu virus changes and mutates over the years as it goes from the northern to the southern hemisphere. Thus, the SARS-CoV-2 or the COVID-19 virus will probably be in the same space, and I figure we'll probably get into an annual COVID vaccination, and we might organise that rather in the same way as we do the flu vaccination programme. But that's me guessing as to what the future may play out like. I don't know.
You stated earlier that the figures have been rising during the Christmas, and you know that people should expect also the figures to continue rising, and probably more hospitalization as well. We've seen in some parts of the country they've cancelled non-emergency surgeries, things like Manchester. Do you fear that might happen in Sheffield as well?
It's probably inevitable, to be honest. Hasn't yet happened, but we would go there very, 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 very reluctantly because it has consequences. But if it's happening in Greater Manchester, it stands to reason it's going to happen in the other big conurbations. And there are hospitals up and down the country that have declared black alerts, which almost by definition, the hospital is becoming overwhelmed. What we're not seeing is intensive care beds being overwhelmed that we were seeing in wave one. You know, intensive care beds in wave one were 70, 80, 90% people with COVID in them. That's not now the case. And that is the impact of the vaccination program. But because there are so many people with COVID, that does feed through to some of them being poorly enough to be hospitalised. That has consequences because the NHS and social care will do what it always does, provide the best possible care, but according to the clinical need that's presenting at the time. And if there's a whole load of people with COVID that have pressing healthcare needs now, less pressing needs will get deprioritised. So that will be a regrettable consequence of the very, very high case rates.
And if there is to come, do you think Sheffield is well equipped? The NHS in Sheffield is well equipped?
Yes, it's as well equipped as it can be. We've been here before. We coped, but there were consequences, and people's elective operations were delayed, and that has consequences. And also the work the GPs do gets delayed. The work the GPs do with regular diabetic checks or regular blood pressure checks, and all of the other stuff the GP, all of that also gets delayed. So we talk a lot about hospitals. We should also talk the same about primary care and social care. But yes, the NHS and social care system is as well equipped as it can be. Remember that it's as well equipped as it can be, but with less staff, because a lot of them are off because they're isolating, because they've got COVID, or they're caring for somebody that does have COVID, one of the kids or an elderly relative. So all of that makes for a very, very turbulent winter period for us, sadly.
So what will you say are the main risks if people continue to be unvaccinated, or if people continue to be skeptical about taking these vaccines?
The vaccination program, I'll quote some numbers now. So the risk of death from COVID is about 1 in 100. It's probably a little bit less than 1 in 100. The vaccination has reduced that to about 1 in 1,000. It's reduced it by 90%. So it's not quite to 1 in 1,000, but and ditto, the hospitalisation rate has been reduced by 85% thereabouts. So the reality is most unvaccinated people with COVID will probably have reasonably mild symptoms, but some will have very, very significant symptoms. But vaccinated people very rarely, if ever, get hospitalized. So the vaccine protects us from hospitalization it's undoubted. You can see it with the naked eye, and you don't need me to do any fancy statistics on that one. It does come with side effects. The most common side effect is a sore arm. I had the sore arm on both occasions. They didn't give me a Mr. Bump sticker to put over the shoulder, put on my shoulder. I was very upset with them. But on all of my vaccines, I had a sore arm. I know of people who've had flu-like symptoms for a couple of days, and again, they tend to resolve with some paracetamol. COVID doesn't tend to resolve with some paracetamol. The people I know have had COVID have been pretty poorly, actually. They've had what you could only describe as a cold from hell for a week or so. I'm not lucky enough to know anyone that's been hospitalized, but I know people that have, and they've been really, 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 really poorly. So vaccination significantly reduces the risk of that. But people, as I say, people need to choose whether or not they want to be vaccinated, and only they can make that choice. But I hope they make the right choice based on good information, not duff information.
And lastly on this, whilst I've got you, in terms of support, be it for COVID or, as we've seen, as a result of COVID, this has kind of like affected quite a lot of people mentally and emotionally. What support is out there for people in the city?
The same support as there's always been. So there's a hardship fund, there's the isolation payments, and then the wide range of mental health support. Nothing much has changed. If you need me to find numbers, I shall do so, but I'll do so offline because I can't remember those numbers off my head.
No, you don't have to give numbers as long as it's just for people to for people to know that that there is support out there and where to get the support.
Yeah. It's the same. So I'll dig out the number and I'll make sure you got it for when this goes out.
That was Greg Fell, the Director of Public Health, Sheffield, giving us the latest update on the Omicron variant in the city. However, that's all we've got time for tonight. Join us again, same time next week. Until then, thank you for watching and you have a very good night.